Hi, my name is Rebecca, and my group is doing communication. So I just want to start off by saying that communication is a process by which information is exchanged between individuals through a common system of speech, symbols, signs, or behavior. What that means is not all people communicate in the same way. Not all people can communicate in the same way. Some people use a form of nonverbal communication. Some people may use verbal communication. And this presentation is going to go through the different aspects and what that means to communicate with one another through different techniques and strategies. So first, a conversation takes place between two people at least, a listener and a speaker. And to communicate with some people, they need assistance, whether that's a device being technology, symbols through a paper form, or just having another person assist them with communicating. And as healthcare professionals, communication is so important for us to form accurate assessments, diagnosis, care, and treatments of all the individuals, patients, and clients we're working with. By being able to communicate with them, we want them to understand that we are here for them. We understand what they may be going through. And even if we don't, we empathize and we sympathize with them. We want to do everything in our power to help them get to where they need to be. And that's how we can form relationships with them so that they can trust us, which will help with motivation and their recovery process as well. Because failure to communicate effectively with individuals with an IDD, cognitive, or communication disability can truly result in just not being able to identify proper health concerns, missing something, which could inevitably lead to something much worse.
Hi, my name is Mary. I'm part of the group discussing communication. As mentioned in the previous slide, communication is extremely important in the healthcare field because we need to be able to determine the care of the patient appropriately, diagnosis and all treatments. Conversation usually takes two people, a listener and a speaker, as mentioned before as well. So kind of just recapping there, how we can communicate it with individuals with IDD. There's a lot more factors that come into play. For example, types of communication. So verbal communication, as I have discussed here, is the use of language in spoken or written form for the exchange of information, ideas, or emotions. These can be spoken or written words directly given to that person. Language and dialect all play a role in there. So, how you say things, when you say things, whether you're using formal or informal speech. Sometimes there can be language barriers amongst people, and verbal communication also is is a way to express emotion, and you're waiting for that immediate feedback from the other person. So again, this can be more formalized or informal depending on the scenario. Your tone or pitch can be different depending on how that person perceives what you're saying. You can convey complex ideas via verbal communication. So again, in the healthcare setting, this is one of the main ways that communication takes place, but not all the time necessarily. Hi, my name is Mary.
Hi, my name is Riley, and now I'm going to talk about effective ways of providing communication with people with IDD. So the first one is to treat adults as adults. It's important to always address the patient with respect, regardless of their disability. Speak directly to them rather than to their caregiver or companion. The second strategy is to adjust your communication method. Every patient is different, so adjusting your approach based on their response is important. It's important to use simple, direct sentences when needed and to supplement with verbal communication with visual aids when necessary. It's important to use concrete as specific language. Avoiding abstract concepts or oversimplified wording can be confusing, so it's important to use more specific language. When possible, try to use language that relates to things the patient can see or things that they've experienced, and try to refrain from using directional terms, which can be confusing to some people. It's important to repeat and reinforce information. So be prepared to repeat information multiple times in different ways. Try to avoid phrasing questions in a way that suggests a preferred answer, as some people may tell you what they want you to hear, and you really want to know how they're actually feeling. It's important to give clear and direct instructions. So try to provide exact instructions, such as the doctor will be in at 10:30 rather than the doctor will be in 15 minutes. Also try to avoid giving too many instructions as once, as that can get pretty confusing. The sixth one is to minimize distractions. So try to find a room that's quiet to talk with them in. Try to turn off, there's a TV on in the room, turn that off. We don't want any background noise or distractions, because that can create sensory overload, and we want to be sure that they're understanding everything you're saying to them. It's important to also provide information in multiple formats. Some patients prefer written instructions, while others do better with verbal. So ask the patient what works best for them and then go from there. And finally, it's important to be patient, flexible, and supportive. If you don't understand what the patient is saying, ask them to repeat it rather than guessing. Recognizing that some patients may struggle with reading, writing, even speaking, try to provide alternative communication options for them. So as future medical providers, it's our responsibility to advocate for these patients and to have better communication practices to ensure that all patients, regardless of their abilities, receive the care and respect that they deserve.
So I'm going to be discussing nonverbal communication, and what that is a transfer of information from one person to another without the use of spoken language or words. So there's different types of nonverbal communication. What that means is you can use gestures like hand motions, pointing, protests, to basically let someone know that you don't want something that they're offering you or that they're saying, requests to let, again, someone know that you do want something, different facial expressions by showing your emotion, if you're happy, if you're sad, annoyed, upset. Also body language, and then eye contact, because in different cultures and different religions, eye contact has different meanings to it. So what that means is, in America, obviously, just making eye contact with someone is a polite form to let them know that you're listening to them, you're paying attention, and you want to know what they're talking about. However, in other countries, to make eye contact with someone for longer periods of time, it can be disrespectful and rude. So you kind of want to watch out for that depending on where you are. And for the function of nonverbal communication, it shows your emotions, attitudes, and one's purpose for having that conversation and trying to communicate with you. And you always want to do that, because if someone isn't able to communicate with you verbally and through spoken language, they may want to let you know that they're upset about something or that they're really excited about something. So by you being able to read their body language, their emotions and whatnot, that can just truly make or break the conversation, and vice versa. Them being able to understand your emotions, your attitude through their tone and pitch can really help, again, with the flow of the conversation and for comprehension in general. And the importance of it is it allows for social interactions for those that are unable to use a spoken language, and can just help and interpret to understand what someone is saying, their thoughts and their feelings, because someone that's not able to use spoken language to communicate is already feeling maybe left out about themselves, that they're not able to communicate at a level that most people are. And you want them to feel like they're being understood and that they can still have their own voice in their own way, and that people do care about what they're trying to say and what their thoughts and feelings are.
My name's Cameron, and I'm going to walk you through some of the strategies that we can use as healthcare workers to help communicate with nonverbal individuals. The first is using nonverbal cues. Our body language, facial expressions, and eye contact can speak volumes to individuals who are not able to communicate with us. It is important for us to pay attention to the patient's posture and any sort of small gestures that they might make. If a patient were to point or move their hand towards something, it's important that we would respond, letting them know that we understand what they're trying to tell us. And even just reassuring them by smiling or touching can help show them that they can be comfortable around us and they're safe. The second strategy is using AAC devices. There can be tools out there like picture boards or communication apps that can be helpful in these situations. And the communication boards include pictures or symbols or letters that the individual can use to point and express what they're trying to tell us. And a lot of hospitals now do use tablets and technology, and they're able to customize the communication for that specific person. It is also very important for us as healthcare workers to be patient and give the individual some time. Since they are nonverbal, it does take extra time for them if they were to use a picture board to actually point to each letter to form a sentence. So just giving them the time to process and indicate what they are trying to tell us. It's also important for us to keep our instructions and questions simple and direct. We can ask questions that will allow them to respond with a simple yes or no. They can still understand our spoken language, even if they are nonverbal. So it's important to understand that. So we are just not avoiding them. Another important strategy is to involve a family or caregiver that might be there with the patient. Even though we are going to directly speak to the patient, it's important that the family understands what kind of method we're going to be using to communicate with them and allow them to have some sort of insight in what we are trying to communicate to the patient. Overall, it's just important for us as healthcare workers to adapt to the individuals because each patient that we see is not going to be the same. And it's important for us to understand what kind of strategies we can use, no matter if they are able to speak or not. And in the next slide is going to be our references.